Good afternoon, everyone. I'd like to welcome you all to today's panel discussion in honor of Hispanic Heritage Month. I am Dr. Marcel Davis, the Director of Diversity, Equity, and Inclusion here at VCU Health, where we are focused on promoting and advancing DEI throughout the health system in the communities we serve, as well as ensuring that everything we do, say, and touch is done so with equity at its core. I also want to extend a warm welcome to my esteemed colleagues, Dr. Karen Hendricks Munoz, Interim Chair of the Department of Pediatrics, Interim Physician in Chief of Children's Hospital of Richmond, and Deputy Director of VCU Center on Health Disparities. Dr. Munoz, may I call you Karen for today's discussion?
Absolutely.
Thank you so much. I appreciate that. Thank you for being here. Our second panelist is Elizabeth Valise. Elizabeth is Associate Vice President of Talent Management and Organizational Development and Family Care Services. Elizabeth, welcome to today's discussion.
Thank you for having me.
Absolutely. Evan Lee Ferrand is a medical interpreter, supervisor in the Language Interpretation Department here at VCU Health. Evan, welcome to today's discussion.
Thank you.
And we do have a fourth panelist joining us. He is currently in service, and I'd like to introduce him because he will be joining us at some point in the discussion. So I want to be sure that we make space for him. His name is Dr. Jose Munoz, and Dr. Munoz is a physician in pediatrics here at VCU Health. And welcome again to all of my panelists. And I want to just say thank you as we celebrate Esperanza this year. It's September 15th to October 15th, 2021. And so today's theme is along those lines, Esperanza, which is a celebration of Hispanic heritage and hope. Colleagues, your backgrounds are incredibly diverse, not just personally, but professionally. And that's why each of you were strategically chosen for today's discussion. So not only am I selfish because I get to work with each of you, but I'm also incredibly excited to tap into your individual and collective brilliance and expertise. And I want to give each of you the opportunity to introduce yourself and share your tenure, a little bit about you, who you are, and what you bring to VCU Health. Evan, I'd love to start with you.
Hey, thank you, Dr. Marcel Davis. Hi, everybody. My name is Evan Lee Ferrand. I am a Spanish medical interpreter, and I am the supervisor for language services here at VCU Health. A little over 2% of all of our patient population here at VCU Health are actually limited English proficient patients. We serve about 5,000 to 7,000 patients every single month that required interpreting and translation services, of which 70 to 80% are from the Hispanic and Latino community. And it's an honor to work on this team. I've been supervisor for this department for 3.5 years now, and I've been a Spanish medical interpreter for over 13 years, primarily in Minneapolis and St. Paul, Minnesota. So it's been an honor to be invited to this panel today.
Evan, wow, thank you so much. I bet living in Richmond is a little bit different from living in Minneapolis.
Clear skies. Better weather.
Thank you so much for that. Karen, I'd love for you to introduce yourself.
Sure. I'm Karen Hendricks Munoz. And Marcel, and thank you so much for inviting me to participate today. It's my pleasure to really speak to the community and to those of interest about what we do here at VCU. But I am the interim chair of the Department of Pediatrics and the interim physician in chief of the Children's Hospital of Richmond. I'm also the director and the division chief in neonatology, which is neonatal critical care medicine. I've been doing that I feel like my entire life. I certainly have been in Richmond since, this is my 10th year at VCU. I was at New York University before I came here. And I am also, as Marcel said, the Deputy Director of the Center on Health Disparities at VCU. So have lots of opportunities to improve the health for mothers and children in our communities. So I'm really delighted to be here today to speak with you. Thank you.
Karen, thank you so much. What a phenomenal background. I didn't realize we came to Richmond right around the same time because I've been in Richmond. January will be 10 years. So we came here around the same time. So welcome. Thank you for that intro. Elizabeth, I'd like to turn to you.
Certainly. Hello, everyone. My name is Elizabeth Veliz. I am the Associate Vice President for Talent Management, Organizational Development, and Family Care Services here at VCU Health. I have been with the health system a total of 4 years on November 17th of this year. I originally started as the head of human resources and organizational development for Virginia Premier Health Plan. I oversee everything having to do with talent development, organizational development, intervention strategies, leadership development, growth and development plans, competency-based learning and development, instructional design, as well as all of our child care centers across the health system. I've actually only been in Richmond for 3.5 years. I moved here from Yorktown, Virginia. I was previously married into the military for 10 years, which is what brought us to Virginia in 2011. And a few years ago, when I took the opportunity at Virginia Premier Health Plan, I decided to move here to the Richmond market. So what do I bring to VCU Health? I think a really wide variety of experiences. My background is incredibly diverse. I spent the first 12 years of my career in operations in one way, shape, or another, and then transitioned to human resources. And I've held, top level HR positions since 2010, 2011. So it's a pleasure to be here.
Tremendous. Elizabeth, thank you so much. I appreciate that. So I want to take just a couple minutes and walk us through sort of our format for today's discussion. I have a few questions that I prepared in advance just to kind of get our conversation going. I did a little bit of research before, chatting with you all today. So I'd like us to do that. And then at the very end, if anyone in our virtual audience has any questions, I'll be happy to answer, put those to the panel, and then you all can answer those as well. Does that sound like a great format for today's discussion?
Yeah, sounds good.
Yeah.
Awesome. All right, good. So I know I'm preaching to the choir when I say this, right? But for tribute months like this, like Hispanic Heritage Month and sometimes Black History Month, but particularly Hispanic Heritage Month, we see some organizations looking for ways to connect with the Latinx population. And oftentimes they may do things like changing their brand or, putting Spanish or sometimes Spanglish in some of their social media posts. And I understand that not all individuals that celebrate Hispanic Heritage Month, or certainly within the Latinx population, not all of them speak Spanish. And so oftentimes when organizations do things like that, it runs the risk of being tone deaf, right? And I'm a huge advocate of using 3 verbs when I talk about DEI work, and that's listen, learn, and act. We listen to one another so that we can learn from one another and then act together. And so I'd like us to use today's opportunity to really learn about the shared culture and various subcultures that fall under the umbrella of Hispanic Heritage Month. And that's particularly important for us here at VCU Health because as a safety net hospital, the demographics of our patients continue to evolve. And we recently analyzed some data, and Evan, thank you so much for sending us that data because the data points to that. For example, you mentioned a little over 2%. So I had a couple other data points that I wanted to share. 2.2% of our patients speak Spanish as their preferred language, and that's health system overall. 4.25% of patients are documented to be Spanish, again, health system overall. 10% of our outpatients in OBGYN are Hispanic. 25% of our patients in inpatient pediatrics are Spanish speaking. and 37% of all patients in labor and delivery speak Spanish. Those data points are clear indicators that we must have the services, the team members, and the resources needed to ensure that we can effectively meet the needs of our patients. So today, I'd like to use our time to learn from each of you so that we can be more introspective as a health system and determine what opportunities there are to, one, increase our Latinx population across our health system, two, better support our team members who are Latinx, and three, better meet the needs of our patients. Now, my first question may seem like a simple one, but it's an important one. And that's because there's a lot of conversation around this. Now, there are many names that can be used to describe the various communities that celebrate Hispanic Heritage Month. But in your opinion, what is the best way to address the broader community? Is it Hispanic? Is it Latinx? Or is there another term? Or does it differ based on who you're interacting with? Elizabeth, I'd love to start with you.
That's not a yes or no or definitive answer. And I will use myself and my upbringing as an example. I am first generation Cuban American, and I grew up in a small little city called Union City, New Jersey, right across the river from Midtown Manhattan. And I'll be honest with you, we did not call ourselves Latinos. That I never heard the term Latina growing up. I was Hispanic. So as I grew up and I explored beyond my little 2.1 square mile bubble of Union City, New Jersey, I started to learn that there are so many different other respectful ways of referring to the Latino, Latinx, Hispanic community. And each person, depending on how they grew up and where they grew up and their background, I think has a preference. For me, I've been around other Latinos and people of Hispanic heritage. And when I've said Hispanic, they've actually said to me, "Oh, that's a really derogatory term." And I'm like, okay, but that's what I was, that to me, it's not derogatory, and I am Latina. So I think it really depends on the individual. And I don't think that there's one term that everyone is going to agree is the singular term to cast a wide net on this very vast and extraordinarily diverse and rich community.
That's awesome. Elizabeth, thank you so much. Dr. Jose Munoz, I see you've joined us. Welcome, and thank you for taking just a few minutes out of your time today.
Thank you so much. Somehow I had a Zoom link on the calendar, the one that said Zoom hold. So I was trying to go into that, and there's nobody there. So thanks for sending me the Streamline link.
No, you're so welcome. I'd love for you to introduce yourself to our virtual audience.
I'm Dr. Jose Munoz. I'm a professor of pediatrics at Children's Hospital of Richmond. I'm also infectious disease trained, and I practice in hospital medicine. I'm also the director of medical director for quality and safety at Shore, and also Karen's husband.
So being Karen's husband should have been first.
I'm sure I'll get in trouble for that.
I love it. I'm only kidding. Dr. Munoz, may I call you Jose for today's discussion?
Absolutely.
Awesome. Thank you so much. So I just pitched our first question, which was, there's so many different ways to refer to all of the different communities that fall under Hispanic Heritage Month that celebrate. And so Elizabeth was kind enough to give her perspective on that answer. And Jose, since I have you on the hot seat, so to speak, would you mind sharing your thoughts on that question?
I caught the end of Elizabeth's comments, and I totally agree with her. I think it's very I can tell you that in Spanish itself, I remember, certainly from my mother and my father. I'm Cuban. I came when I was 11 years old to the U.S. But I mean, in the Spanish language, my mother always liked to say, "No, somos hispanos." So being Hispanos was definitely for us not a derogatory, term when used in Spanish. I don't know if within the American culture, the way the term is used, maybe it is. But I always thought that Hispano was, it referred to, the language origin of where you were from and so on. The so I think things have changed, and I think a lot of it has to do with, what do people call themselves, and what do people, like to be referred at. Some people don't even like to be called anything in particular. Like to be categorized into anything. And certainly in the hospital, we have so many children that are from Spanish-speaking countries. And I would say that I usually ask them what country they're from, and I just call them, Mexicano or Guatemalan. Whenever I can, I try to use the country of origin, because I don't think they automatically see themselves as having joined a larger group that includes, all the way from Chile to Mexico. So I think it's very individual, but I think Latin is fine, and it's fine. That's fine for me. I don't know what you guys think.
Jose, thank you so much for that. Karen, I'd love to hear your thoughts.
Well, I was so glad that Elizabeth went first with that question, because I don't know the answer, but I do have some reflections that very much, I think, mirror Liz's, response. I grew up in New York City, and we were Puerto Rican in New York City, and the neighborhood was a Puerto Rican neighborhood. And we would write down we were Hispanic, when we did surveys or somebody. But other than that, we were Puerto Rican. And when we met other Hispanic individuals, it was really always a conversation of, well, where are you from? And, from Argentina, or, Costa Rica, or, Ecuadorian. And I have that same interactions with my patients. They're always delighted that I can speak to them in a language that they feel very comfortable, and they want to know about me and where I'm from. And I, of course, love to hear, about them and where they're from. So I think the Latino or Latina label sort of came later, and then it evolved. And now there's the Latinx, and I don't know about that. So anyway, those are, my thoughts. But I don't really think there's a consensus of how best to. I think it's really a label. Somebody wants to try to put everyone together in some little pot that's easy to evaluate.
Yes. No, I appreciate that. I grew up in Brooklyn, Karen, and I don't have the privilege of being Puerto Rican, but I was often thought to be Puerto Rican. And so even today, sometimes I'm called, "Oh, you look New Yorican."
Yes.
And I said, "Oh, is that a term too?" So yeah, thank you for that insight. I appreciate it. Evan, I'm going to turn to you. Based on your background, what do you think? What do you hear from our patients? What do you hear in your background? What do you recall from your background?
Yeah, so just to be transparent, I am actually Asian American. I'm mixed race, so I get taken for so many backgrounds, but my actual biological roots. But I grew up in Minneapolis. It's the 7th largest community of the Mexican diaspora in the world. A lot of people don't really realize that when they think about the Mexican diaspora and the Mexican community.
Did not know that. Yeah.
Yeah, so a lot of people, most people are from the city Morelos, Mexico. So they call it Morelosopolis. And it's really, I think when we talk about the international community, the international diasporas in the U.S., There's so many that naturally, as language evolves, we want to come up with the most efficient ways to refer to communities. And it's one of those things where, I'm trying not to nerd out on linguistics here. But it's with language and identity, it's like so many things can be true at the same time. And so, when we look at the history of why did the word Hispanic and Latin come into existence in English, it was really to map out all the immigrant communities into one face. And if you, within the Spanish speaking community, which is, I mean, billions of people, to say someone from Chile is the same person from Mexico City, it's, you really can't call them all that you're all the same. But then again, you go to like a Calle 13 concert, you can't say there isn't a Latino identity as well. And so working with the community and being a linguist and being in charge of choosing a word to say, I think at the end of the day, it's all about what language can I use, what word choice can I use that's going to be the most relatable. And so I even had, Minneapolis, I mean, it's a very, very left city. It's very open. It's very young. It's a very young city. And so everybody from, I had, I had a community member come to me, and she identifies as, non-gender conforming, and she identifies as queer. But at the end of the day, she wants me to work for her grandparents, for her abuelos. And she goes, Evan, I'm Latinx, but you're here to work for my grandparents. And my grandparents are Latinos or Hispanos or Mexicanos. So please speak to them, because it's, language and identity is changing generation after generation. Mm-hmm. And, while in the US, in English, it's really easy to think that language and grammar should be gender neutral. And it's a beautiful thing that's happening in the English speaking world. But it's not one or the other. And for other languages are still having these dialogues among themselves. And so, at our team, we do tend to stick to the word Latino, or like Dr. Munoz said, we also just like to get to know the individual too, because in the community, not one person isn't everyone. And so just getting to know their own backgrounds, right? These countries may be small, but they're so rich and deep in their own identity and culture and beliefs that we always want to make sure that we try to see them as individuals and as families and as local communities. And especially as linguists, when an interpreter, when we get to know their particular preference, it's just simple things, right? Like a baby bottle. When we say when we say we want to use your word, you can just see the tension fall off their shoulders. It's like, oh, okay, I can be myself. I can speak in my preferred Spanish, not just my preferred language, but my preferred Spanish, right? And so it's a very beautiful thing that my team fosters as a culture here.
Wow, that's so powerful, Evan. Thank you. Because, so often we have the misconception that we can just translate, materials into another language and be able to connect that way, when that's so false, right? So gosh, you opened the door to so much. No, I appreciate that. That's incredible insight, all of you. Thank you so much. My second question is really more personal to each of you, and that is, Hispanic heritage takes so many different forms of expression, right? You all talked about that based on your backgrounds and where you've lived and where you are now. What is it that you would like anyone in our virtual audience to know about your Hispanic heritage? I'd love to start with you, Evan. I know you're Asian American, but again, you connect with our patients in a way that none of us do. I certainly don't, right? Jose does. He connects with our students. He connects with our future physicians, Chair and Chore, Medical Director for Quality and Safety. Karen, you connect in Chore in a different way. Elizabeth, you connect with our team members in a different way. But Evan, you bring something that none of us do. So I'd love to hear from you based on your background and how you connect, even with the abuelos of the person that you just talked about, right? What do you want people to know about Hispanic heritage?
Yeah, I think thank thanks for putting me on the spotlight for this one. So I always, my entire vocation pretty much is really based in how I was raised by my mom and the community she comes from. She's from Hong Kong, which in my lifetime went from British territory to Chinese territory. And Hong Kong is a very rich, linguistically, ethnically, internationally, and we have three co-official languages. And our partnering territory, Macau, um, also has their own co-official languages. And so between all these cultures in the Cantonese diaspora, we speak English, Mandarin, Cantonese, and Portuguese. And so growing up, my mom always made it intention to raise my brother and I to be US citizens and to look at languages as a civil duty. And so just in the same way in Hong Kong, if you're multilingual, you're not necessarily you're not considered almost talented. You're just fulfilling your duties as being a citizen in a co-official world. And so my mom always raised us saying, "You're American. Spanish is a co-official language." And it took me a long time. It took me into my 20s to realize not everyone was raised this way. And I realized that my mom gave me a huge gift to raise me as American, to see the Spanish diaspora as American. That was just the politics in my house. And so growing up, I always saw it as my civil duty to know the language that is part of the backbone of this really rich country. And because I was raised in that lens that the U.S. is not one identity, it's not one language, it's not one food, it's not one culture. It is many, and it's not like an additional add-on. It is an essential part of who we are as a country. And I think one of the most rewarding things about what I do, what my entire team does, is we remind people that we're not here to translate the foreign national experience. We're here to translate the Richmond, Virginia experience. And that, even in Richmond, Virginia, it doesn't come in one language. And it's our pleasure that you need professionals like us to understand that experience. And we see it day after day how to bridge these two sides, it changes medicine. Providers change who they are because they understand who their local community is vis-a-vis an interpreter.
Wow, so powerful. You talk about the American experience. I was born in the Caribbean, and my parents, when we moved here, my parents taught me the same thing. This is an American experience. You're a Caribbean girl living in America.
Yeah.
So I appreciate that. Thank you so much. Elizabeth, I'd love to hear from you. What do you want people to know about your Hispanic heritage?
So it's really interesting because while I was born in Teaneck, New Jersey, and raised here, I grew up in a place where it was like 95% Cuban. Where I grew up, it's a lot like Hialeah, Florida, right? If you did not speak Spanish, you were at a disadvantage in my neighborhood, and so I was raised very Cuban. And when people hear me speak Spanish, they're like, "You sure you weren't born in Cuba? Because you've got the Cuban accent down like perfect." But what I would like people to know about my heritage is, we are a very expressive people. We're a very expressive people. We are a very resilient people. We have to be, because where the rest of my family is in Cuba, there isn't anything aplenty. So the only thing that is aplenty is their resilience, given the circumstances that they live in on the island. We are a very culturally diverse people. In Cuba, there is the strong African influence, there's the Spaniard influence, and then you bring those two influences together and you have this incredible, rich culture with amazing music and incredible art that is just this confluence of that African and European influence. And we are expressive. I remember growing up in a household where everybody was loud and boisterous, and we would all talk all over each other. And, imagine me growing up in that type of environment and then jumping into the Fortune 500 world and recognizing very quickly how I had to become very culturally sensitive to, you can't talk over each other. You can't be, that's not okay. Right? Come on, you guys know what I'm talking about.
Yeah.
And so we're just such a richly cultural group of people, and I would love for people to understand that and really dig deep on that, on our expressive nature. I often get told, wow, you're really direct. It's not that I'm direct, it's that I'm expressive. Very expressive. I'm going to give you, if you ask me for my opinion, I'm going to be very honest with you. Now I'm going to be very kind, because I believe that those two should live together, honesty and kindness.
Yeah.
But I think the biggest thing is, we're very diverse, and we're incredibly expressive people.
Elizabeth, come to our staff meetings. You'll feel at home.
Oh, I would love to.
I want to come too.
We
can't take minutes. It's impossible. You need 5-minute note takers for everyone speaking for themselves.
I love, but you know what that means though, Evan? That means that everyone brings their full selves to work, that the culture on your team allows for that, which is so incredibly important. And you're jumping ahead, because that's actually one of my questions later. But thank you so much for that. And Elizabeth, I'm taking notes. You said expressive, you said resilient, and you said culturally diverse. You said loud. I connect with that, because my mom always said, oh my gosh, you're so loud. Like when I left home, eventually moved out, I would say, Mom, you miss me? She goes, it's really quiet. Translation, I miss you. She just said it in a different way. So I appreciate you sharing that. Karen, how about you? What do you want our listeners to know about your Hispanic heritage?
Well, I think that I definitely share both Evan's and Elizabeth's mother's feelings. My mother very much expected us all to understand that we were Puerto Rican Americans, and that Puerto Rico was America. And so often I will be asked that, well, do you need a passport to go there? And so I think that, as I thought about this question, I guess I would really like people to understand that Puerto Rico, very diverse, and warm people. We are a combination of Taino Indian, Black, and Spanish heritage. We are Americans. The island of Puerto Rico it's part of America, and so we are all citizens when we are born. And so we don't need to have a special passport to come and visit. It's like as if you were flying from New Jersey to Virginia. You don't need a special passport. We still have to go through, all of the airport situations that one has to go through in terms of, advancing. But we do have words for each other if we were born on the island, versus the mainland, which is the United States, and New Yorican, and all sorts of different endearing terms we have for each other. But I think, and we speak English, we do, because we do speak Spanish, and that is our language. That is, and probably Puerto Rican Spanish. That's another, conversation of Spanish, and that's always fun to learn. What is the preferred word for things, as I talk to and try to support my families in the intensive care unit or in obstetrics and gynecology. I just really want to make sure that they to use the words that they choose, and so they can feel comfortable with the care that they're getting. So I think we're very expressive, and we're good listeners too. So I think we're sensitive people. So maybe you'd add that too.
I will. I love it. My list is getting pretty long. I like it. Thank you so much, Karen. Jose, how about you?
I mean, I certainly agree with everything that's been said so far. I think, there's diversity, even, there's diversity within each country. I mean, first of all, you can start with Cuba or Dominican Republic or Puerto Rico. I mean, there's diversity of race, there's diversity of culture, diversity of the way people speak, even in some other countries. In some parts of the country, people will speak differently than other parts of the country. And so I think the diversity within each country, and then of course, then if you once you lump people into Hispano or Latino, then you're getting the whole super diversity of the fact that all these different countries. I'd like to see more being done to promote how rich the culture from Latin America is. We're talking about literature, some of the finest literature that's ever been written. Music. Like in Cuba, for example, Cuba has a rich ballet tradition. There was a famous Cuban ballerina who died a few years ago, Alicia Alonso. The New York Times ran a whole article on her when she passed away. I don't know if you remember, Karen. One day we were watching television, and they had the story of this young man in Cuba, and he was a black Cuban, and he was an amazing ballet dancer. He lives in England now, so he became like one of the most famous. I'm blocking his name, So Cuba has this whole classical tradition as well. And then you go to Mexico, it's the same thing. Mexico has incredible, classical music and literature and so on. And then you go to Colombia, and then I used to love reading all the stuff from like Garcia Marquez and all the wonderful literature that's there. So I think just to people to be aware of the diversity of cultures, the diversity of music, the diversity of racial backgrounds. Because sometimes people get this sense as well. You don't look Cuban, or I mean, if you follow baseball, I'm a big baseball fan. I mean, just look at the baseball players. You have like the Dodgers. I was watching the game the other day. They have Albert Pujols, who's a great baseball player, and he's Dominican, and he's a pretty light skinned guy. And then you have people like David Ortiz or Pedro Martinez. So it's just the diversity of people. There are a few things from the Caribbean that people. I find it useful sometimes to, when connecting with people about the Caribbean and stuff like that. Baseball, I think, is a good thing to link to because, baseball is so big in the Caribbean and even in Venezuela, Panama, and so on. And then baseball is big in the U.S. So that's a nice thing to connect to. But even the diversity in sports. I mean, when you go to I don't know if you saw in the Olympics, there was a Puerto Rican woman who was in the rowing, the women's rowing competition, and it says she's the first Puerto Rican woman to be in the Olympics, as rowing, which is, I thought that was amazing. The Cubans have runners and people in different sports and so on. So I think if we wanted to do something like that, it would be to really emphasize the music, the literature, and the cultural diversity.
I love that. Thank you so much. And as all of you shared, the colors in my mind just kept getting brighter and brighter and brighter because to all of your points, the culture is so incredibly rich and bright and colorful. And so I sort of got this picture of colors in my mind. And as each of you added your own personal story, the colors just got brighter in different shades. And so I appreciate you making that personal for me. And I appreciate all of you being so transparent and sharing your heritage with us. I wanted to talk a little bit get to some hard questions, right? So each of you has varied tenure here in the health system, and you sit in different parts of our organization. I want to talk a little bit about culture because, Evan, you sort of pointed us in that direction when you talked about your team meetings. What culture changes have you seen during your time here at VCU Health, and what are some changes that you think health systems as a whole can make to be more inclusive of this rich diverse culture? Karen, I'd love to start with you.
Well, I do think that the changes I have seen has been a improvement in, first of all, being able to communicate with families and setting up systems and patients, and setting up systems where we have improved translational services. I mean, even the services that Evan has described, I think just in my 10 years that I've been here, there has just been a huge change from my first days, and first years here. So I think communication, because if you can't communicate with your patients, you really cannot provide the best care for them. You have to have an understanding of their experiences, and that is through communication and communication services. And I think the secondary piece is that there are many of us that intersect in providing that quality care that will make an individual feel, wow, that was really great experience for me. Even in the worst of illnesses, that is an important goal that I think we have here at the health system. And so there are many people that interface in that. Your nurses, respiratory therapists, when you're in your social workers, the physicians, obviously. And I think that one needs to engage all of these individuals that touch patients in, even the person that brings in your food trays, all staff and are so important to providing that great experience and that healing experience that we need to provide, for our families here. So I think things have changed. I guess that's a very long, lot of answers, I think, in trying to get to that question. I think we still have more to go. A lot of because our providers sometimes are not as diverse as our patients are. And so that ability to make sure that that you as a provider reach out to the patients and gain better understanding of what are their situations, I think that becomes important as well.
So incredibly important. Karen, thank you so much for that. Jose, I'd like to jump to you. What changes have you seen?
I just one of the things that I want to focus on is that, especially since I spent a lot of time in the hospital, seeing patients on the pediatric wards, has been really the growth of the language services people. That was very small. I don't know. Do you know the staff from the language services? Like Claire is one of the ones that I work with the most. But there's several. Mm-hmm. There's several of them. But they're just like an amazing resource, and I think their presence, their interaction with the residents and with the attendings really enriches, creates a certain connection, like that, it sort of like humanizes a lot the whole interaction between the system, between the healthcare system and the patient. So to me, that's been one of I think when we first got here, there may occasionally have been stuff, but we were mostly using the Marty, the little TV screen, that you have somebody, like today we were using. I have two kids we rounded on today that are Afghan refugees. So obviously we don't have any Afghan any Afghan translators in our translating group. So we have to use the Marty. And again, it's a lot more difficult. It's harder to get the same connection as you do when you have Claire. For example, the other day we were rounding, Karen, and I was going to tell you the story. And we were rounding on one kid, and the kid was being followed by surgery, Dr. Lanning, who's one of the senior doctors and so on. So as we were going over the story, Claire all of a sudden jumps in and says, I was here yesterday with Dr. Lanning translating for the patient. So she was able to give us this whole update about what Dr. Lanning had told the family. That's awesome. which I thought was really incredible. So I would say that's one of the biggest things that I have. And just a general increase on awareness and sensitivity of residents and doctors and nurses and staff, when interacting with the Hispanic patients. As far as the system itself, my impression, and maybe I'm wrong, my impression has been that I've always felt it to be relatively neutral. Not necessarily. I've never felt either uncomfortable or super comfortable, or because of my Hispanic background and so on. I would say that that's been okay, but I think definitely a plus in the patient care side with the language services.
That's great. So, Evan, that is your team.
I did not pay anyone to say this.
I didn't even realize that was your team, Evan. So is this being taped? Is Evan going to use this to get more staff and to get raises?
No, but when you think about it, that speaks to how we've evolved over time, right? Because as a health system, we recognize that we're a safety net hospital, and we have to be able to grow as our demographics change. And so that's wonderful. I appreciate that. Evan, I'm going to let you answer next, since, Jose just literally highlighted your whole team.
Yeah, I feel the Munoz family is sponsoring my job right now. That's really nice. If I leave with anything, I have that.
You did not pay us for this.
Yeah, so I guess I'll just speak from the language service lens. We've gone through incredible growth, really, really incredible growth. Not just financial, not just staffing, not just technology, but we also have to think about clinical culture has changed tremendously. And it really has been an intrinsic change, which really shows the level and nature of authenticity when we talk about differences. One thing I give a lot of credit to so many teams, not just pediatrics. I want to say especially pediatrics, but not exclusively, even our ICU teams. People really represent a newer term that's used in our field, which is called cultural responsiveness instead of cultural competency. And cultural responsiveness is really great because competency suggests that anything other is incompetent, right? And so it gets personal. Responsiveness means I don't know, but I want to connect, and I want something different, and I need to learn. And I hope you get to learn. I hope I hope my interaction with you allows you to learn too. And cultural responsive really starts from a place of I don't know, and I hope there's an opportunity to learn. And that's where the interpreter can step in. Or that's when a multilingual staff can step in and just help their cohorts understand better. And what is really amazing is to be able to sit down with team managers, directors, and to really talk about, it's okay, we are where we are, and let's talk about where to move forward. No one takes it personal. No one tries to make excuses. It's not about right or wrong. It's about how do we go forward. That really shows sincerity in a culture, and I'm really, really, it really makes my job fulfilling. Working in a hospital, we all work long hours, and we got to put in work to have things operate. And when you have that heart every day, it just makes your job so much more sustainable. And then internally, I give a lot of credit, not just to the heart of our team, like Clara, David, and Liz, and all of our other interpreters are helping out with the inpatient services and emergency services as well. It's not just our team, but it's also the people that support our team, our managers, our directors, and vice presidents. They put a lot of trust into me, and a huge, strong example of leadership is them going to me and saying, Evan, we don't know. We think you know better. We're going to trust you and work with you along the way. And if we think anything different, we're going to work with you. We're not going to work over you. And it's just one of my goals. It's like, I hope I do that as much as possible to my team. When I say, hey guys, I don't know, I think you know a better answer. How can we implement this into change? And just trying our best to have those conversations as much as possible. So I would say trust, creativity, and unknown.
I love that. And I also made a note of the cultural responsiveness. And so I will make sure I incorporate that language going forward. So thank you for that.
Yeah, it makes people feel more at ease. It's
No, I
more,
like it.
yeah, it's a more fun topic. If I say competency,
Right, because competency indicates there is a destination, an endpoint
yes,
once
yes.
you
And
arrive.
sometimes people say I'm cultural competent, I have a certificate. I'm like, well, let's still have a conversation.
Yeah. Thank you for that. I appreciate it. Elizabeth, how about you?
I think that we, in the short time that I've been here, I think the culture is starting to shift. The fact that you're here, Marcel, is a huge indication of that, right? But I mean, I'm just calling a thing, right? I think the fact that we have someone who now has a team that is focused on having these courageous conversations and and having a focus on where we need to go, I think is it speaks volumes. What lies ahead for us? I mean, we're just starting on this journey as a health system. And so we have a long way to go. And I always tell people, how do you eat an elephant? One small bite at a time, right? So we just have to take this one step at a time. And really, I would say inclusivity and equity are a key component of diversity. We can be as diverse as humanly possible, but if we don't create an environment where people feel included and there's equity, level playing fields, I think we will come up short.
Agreed. And equity is something that it's a simple word, but so many don't understand the difference between equity and equality. So I really appreciate you sharing that. I can't believe we already have 8 minutes left. I don't know how that time flew by, but I want to ask one more question, which is sort of about how we connect directly with our patients. So biases and cultural assumptions are something that happen without we even realizing it, right? Do you think that there are biases and cultural assumptions that may get in the way of any of us connecting authentically with our patients? And Karen, I'd love to pick on you to start, if that's all right.
Yeah, that's fine. I mean, I think that, of course, there are biases that because if you act on your biases, of course, you're going to be going down a different route than maybe what is actually, the situation that the patient is bringing, to the table. I think that, for me, having opportunities to always present the truth as much as I know and my medical experience and medical opinion for my families becomes really important. I think as we, even this journey with our responsiveness to vaccinations and the COVID illnesses, that much of our Hispanic, Latino brothers and sisters are really getting and feeling a big brunt of. I want to make sure that they have a trust in us. And I think that biases can sometimes, because there are biases at both ends, right? So there may be some feelings that we don't trust what's going on at VCU or how I was treated when I was there last. And so I think it becomes really important to use opportunities to educate our diverse communities out there that we are providing them with the truth of the best information that we know medically, for them to stay safe, for their children to be safe. And be healthy. I think that's probably the biggest thing that I would say.
Karen, thank you so much. I appreciate that. Elizabeth, how about you? I'd love to hear your thoughts.
So it's interesting because I'm not in a direct patient care facing role. But the work that my team does impacts those that are taking care of patients. And, I agree with Karen. Are there biases? Are there assumptions? Do people still subscribe to the stereotypes of our heritage and our culture? Absolutely. I think that what is really important is that we create an environment where people can feel safe to be their authentic selves and bring their real selves into our healthcare system, into our hospitals, into work every single day. And our department plays a really big role because we have coaching services that we can coach leaders across the organization to help them understand and uncover maybe unconscious biases that they may have that may be interfering with their ability to connect with our patients and the community members in being able to treat the whole individual. So I do think that there are cultural assumptions. I remember many, many years ago in another organization, someone in a very senior level, it was actually a senior vice president, said to me when he discovered that I was Hispanic, the first question that came out of his mouth was, "Did your parents come here legally?" And I mean, this happened within the last 10 years. So, do I think that there's cultural assumptions? Yes. And that was followed up with, where did your parents cross the border? And even after I said, well, there's no border between Cuba and Key West. It's water. And my parents came by plane. There was still, okay, where did they cross the border? And there was just this natural assumption that because I am of Hispanic heritage, it must mean I came here illegally. It must mean I crossed a border somehow. It must mean. And so I think it's really important to continue the education and continue to expose individuals to the different cultures, and not every Latino is X or Y. There are, my goodness, how many countries in the Latinx Hispanic group? It's more than just 2 or 3 or 4. And so I really think that that's really important, is that we continue our efforts to educate, enlighten, and help develop that cultural responsiveness. I think that's really critical.
So incredibly important. Elizabeth, thank you for that. I appreciate it. I can't believe that he asked that, but that's an offline conversation. Evan, I'd love to hear from you.
Yeah, I think in my career, I think everything for me, funny enough, comes down to time. I think every interpreter, I think what we're always asking for teams is spend more time, invest in more time. Linguistics is a branch of psychology, which a lot of people don't realize. And the psychology of language is we want to communicate ideas at the fastest rate possible. And ironically enough, Spanish is one of the fastest spoken languages in the world. It's a fact. And when we're asking for time, that's a lot to ask in a clinical setting, is to spend double the time to communicate something. Naturally, it's aggravating to spend more time than you emotionally budgeted to get a point across. And every frustration I've seen between all LEP patients and clinical staff is always going down to time. Without eating too much of time in this conversation, right? One time I was asked by a dental hygienist she pulled me from these surgical services and said, just translate this quickly. This mom, her kids' teeth are all rotten. She needs to do a better job. And the mom of these kids was crying in the corner, and she explained, I've worked for the past 7 years to pay for my kids to come to the US because all they can afford in their hometown and in their home country was Coca-Cola. They can't afford potable water. And so Coca-Cola was the only thing these kids could drink off of. And the hygienist broke down and just really felt that had she taken the time to really break down another one's story, and this happens in English to English, frustration and communication always comes down to, we shouldn't be spending this much time to go over what you perceive as simple. And I recognize when I ask people for different actions or perspectives with language access, I'm asking for time. And time is so precious. Speaking of which, I don't want to enter or eat up Dr. Munoz's time or his perspective in this too.
Wow. Evan, thank you for sharing that story. That, puts a face on time and language access. I appreciate that.
That's why we always have to speak on top of each other. There's so much to share in life.
Well, we know that, right? We know that. I appreciate that. Jose, I'd love for you to share.
Just a couple of quick comments, getting back to Elizabeth's comments. I used to be asked that, also, how did I comment? Did I comment legally? So sometimes I'd be like in a sarcastic mood and I would say, I came on a raft, with my parents.
Right.
I got on a raft with my, or we swam across, to Key West, like the little boy from a few years back, Elian Gonzalez.
Yeah.
Like the Elian Gonzalez story. So sometimes I used to tease that. So I think that's one of the assumptions. Definitely, I've certainly, had that one. I think the other thing that I see sometimes, especially like in the hospital and so on, I think it's getting better, but there's still some of that. Sometimes it's the assumption that because the person is not fluent in English, that they're not educated, or that they don't have a high degree of intelligence or the ability to comprehend things. And I think that people from the language services, again, sorry to keep plugging you, Evan, I've done a really good job. I've really done a good job doing it, but sometimes there's still a tendency to just to think that they're simpler, that they're more simple-minded or sophisticated. That is just so not true, at all. But I think those are two of the main ones that come to mind. I think I'll stop there.
Wow. So I can't believe that we're 2 minutes over time. This time flew by with you all today. I have enjoyed the conversation. I've learned so much about each of you. I've learned about the tremendous diversity in the Hispanic culture, and I couldn't have spent this time with a better, more brilliant, more vibrant group of panelists. And so thank you for that. Thank you for sharing yourself and your thoughts and your background with us. And I know we covered a lot of ground, and thank you to our virtual audience for dialing in, participating on Facebook or VCUHealth.org. We hope you continue the conversation. Listening is how we can learn and act together. I truly have the privilege of working with you amazing leaders, and I wouldn't have it any other way, because when I get up every morning, I am thrilled to come to work because I feel like we get to change the world together. Again, thanks to our audience. If anyone has any questions or thoughts about today's conversation, feel free to reach out to me on marcel.davis@vcuhealth.org. Thank you for sharing Esperanza with us. Thank you, and have an amazing day.
Thank you.
Hey, thank you, Dr. Marcel Davis.
Great to meet you guys.
Thank you.
Bye.
Bye.